health warriors. Welcome to this episode of Crafting Mental Health. Hi there, my mental health warriors. Today's topic is Depression Explained. And first off, I just want to say welcome to everybody who's tuning in this week and who's tuned in all the previous weeks. I love hearing you guys' feedback about episodes and questions and all of that. So please keep them coming. If you're trying to find out where I'm at or how to get in contact with me, you can find me on Facebook. I have a group called Crafting Mental Health Podcast, and you can find me there. You can even share that with your friends, family, whoever you think would benefit from hearing these podcasts. Then you can also send me an email at craftingmentalhealthpodcast@gmail.com. And then you can also call me, text me, or even just if you see me out and about, just, start up a conversation. So, but with that being said, one more thing. When you on Spotify and you click the follow button, then it will notify you every time I post a new episode. In there, you can also make comments. You can answer the weekly question, or you can even leave a voice note, I believe. So I am working on getting stuff to put on YouTube and to, put on other places. But, it's a slow process, but, doing the best I can here. So with that being said, I know last week I didn't do a question. I don't know. It was weird. I just didn't feel like I needed to have a question last week. It was like the topic last week was like more of a spur in the moment decision to talk about. So kind of took a little bit of a break on the weekly question, but I also decided to change it up a little bit. I'm going to ask the question in the beginning of the episode, and then I will answer it with my answer at the end of the episode. And then during the week, I would definitely love to hear you guys' your answers and your thoughts. So this week, the question is, what superpower would you like to have if it was possible to have a superpower? What would it be and why? Okay, so jumping into this week's topic, Depression Explained. So just a note to everybody, I'm not a health provider or a mental health provider or anybody with like smart knowledge about what all these mental health issues are. I am just, your regular person that has my own mental health struggles, that has my own mental health things. And I'm just sharing my story. And then I'm also doing research so that I can give you guys some, accurate information. Because, there's so much things out there on TikTok and Instagram and Snapchat and who knows where else that sometimes I think the information that's been given is not necessarily always that accurate, or it's mispresented, or only a little bit of the information is given. And so my thought or my what I'm trying to do is to give you guys as much information as possible as what the time will allow, and just again, like get the conversation started. And like I said, I would love to hear you guys' opinions and your thoughts. And if there's anything that you disagree with, I would like to hear those. If there's anything that I'm talking about that you guys found interesting, because when I do my research, there are a lot of days where I'm like, oh, this is something I've never heard about, or I never, I didn't realize that this is how this works. Or in a lot of cases, I didn't realize how many different like with depression, there's several different types of depression. And, I didn't realize, and a lot of times I don't realize how in depth these things can actually go. And a lot of information you can find from the DSM-5, which is what psychiatrists use or, therapists use to help diagnose people. Now, this book is available to the public, but you guys don't self-diagnose yourself. There's so much different things that goes into being diagnosed that, you won't be able to do it yourself. So if you feel like you have some something going on, go to your doctor, start the process. And if your doctor is not giving you the answers that you're looking for, or if your doctor is not listening to you, because you got to advocate for yourself. So if you're struggling to get your doctor to listen to you, then find another doctor. And, just don't hide away and say nobody would help me, because there are people out there that will help you. There's different organizations, with depression, with a lot of mental health things. The first place I think about is NAMI, which is a website that you guys can register to. And they have also a lot of knowledge, a lot of information, and they also help with finding group therapy sessions. There's online group sessions. There's around town group sessions where you get together. And therefore, you can actually meet people that's going through the same things that you are going through, and therefore you won't feel so alone. You'll have people that will understand what you're going through. Because a lot of the things that we have got going on, sometimes you feel like, if someone hasn't had this mental health thing, they don't really understand. Like what I've talked before about my bipolar diagnosis. A lot of times people don't understand what I'm going through because they've never experienced it. So finding people who's going through the same things as you are kind of just lessens that load or that feeling of being isolated or alone or nobody understands me. Because I can promise you there are lots of people out there who will understand what you are going through. You just need to reach out. So, okay, back to, Depression Explained. So, we hear the word depression thrown around all the time, like, oh, that person's being depressed, or that person has depression. But what really is it? And it's normal to have some form of depression after you've lost a loved one, or you've lost your job, or and it's like you're feeling sad. It's not necessarily depression. It's the same symptoms as depression, but you're feeling sad. And it's normal. It's normal when you have certain situations go on in your life to feel sad, to feel depressed, to feel alone, to feel all of these things. If you didn't make the sport team at school, those things can make you feel sad, and it's a valid feeling. And, it's in some cases a good feeling to have, because like if you didn't make that sport team, then feeling sad, you don't like that feeling. So next year you're going to try even harder to make the team so you don't feel that way again. So the problem comes in when, the depression lasts for longer than normal. Most of the research I've done said that if your depression symptoms last for more than 2 weeks, then it's time for you to go and seek some help. Go see your doctor, go see a therapist. You might want to start looking into getting some help if your depression symptoms either get worse or last for more than 2 weeks. There's sometimes when you go see your doctor, they will make sure that you don't have other things that like medical conditions, because there's some medical conditions that can look like depression. Like if you have a heart disease, or if you have Parkinson's disease or cancer, then you can have symptoms of depression. But once the medical problem has been taken care of or addressed, typically your depression symptoms will lessen or will ease up a bit. So, so a lot of times when you go to your doctor, they will do a physical on you to make sure that there's not something else going on. And then, one of the symptoms might be depression. So, and especially in the beginning, if you're seeking help and you're talking to a doctor, be as open and honest as you can. Even the smallest piece of information can be useful for the doctors to make a accurate diagnosis. Because in a lot of instances, like in my case, I was diagnosed with major depression for a long time, because I always talked about when I always went to go see the doctor when I was depressed. Meanwhile, when I felt good, I didn't see the doctor and I stopped taking my medication because I'm feeling good. Nothing's wrong. Meanwhile, that was the flip side of my bipolar. So now that I finally have the correct medication, I'm always good. I'm always, there's days where I have a bad day at work and I kind of come home and I feel a little sad, feel a little iffy, but it doesn't last. Tomorrow I'm feeling better. Or like my mom went home back to South Africa. She was here for 4 months and she went home, and that's making me sad that I don't know when I'm going to see her again. And that makes me sad. But I know that I will be okay. That sadness is not going to interfere with my daily life like normal depression would. So, but if you have depression, then, some of the symptoms is that you feel sad, you feel alone, you feel like nothing is worth living, you feel like you have issues with memory loss, you have issues with, things that you used to like doing, you feel like you don't want to do them anymore, it doesn't bring you any joy. It affects your appetite. Either you eat too much or you eat too little. It can affect your sleep, and sometimes you sleep too little. My experience with depression and sleep is I will want to sleep for days, and I end up sleeping too much. So according to the DMS-5, which, just so to let you know, DMS stands for Diagnostic Statistical Manual of Mental Disorders, and the 5 is meaning it's the 5th edition. So that's just a fun little tidbit if you wanted to know that. But according to that book or that manual, depression falls under the mood disorders, and depression is classified as a persistent feeling of sadness and loss of interest in things that you used to find joy in. And as I've mentioned, it can cause difficulty with thinking, memory loss, eating, sleeping. It can just affect your everyday life. So I'm sure a lot of the symptoms that I've mentioned sound similar to some of my previous episodes. And that's because a lot of these diagnoses kind of go hand in hand. Typically when someone has anxiety, they also prone to have depression, or like bipolar, you have depression and the mania. Depression and all of these mental disorders, goes hand in hand. So if depression is left untreated, it will most definitely get worse, and it will definitely last longer, of course. And when you talk about depression getting worse, it will get to a point where you will self-harm yourself. You can get addicted to alcohol or drugs in order to self-medicate. And then also the worst part of it is you can have suicidal thoughts, or in some cases people have gone through with suicide. And, and that is so sad because, that is a permanent solution to a temporary problem. And depression is most definitely treatable. You just need to ask for help. So in most cases, like I said, depression is treatable. There are instances where people have, I think it's called like a mutation, where that prevents medication from working with them 100%. But definitely when you start medication or start a treatment, it might take some time to get the right, they call it get the right cocktail, to get the right, settings or the right amount of medication that you need for your symptoms. And again, that's why I say when you see your doctor, you have to be so honest with them. And for a long time, I thought well, I can't share with my doctor all the things that I'm feeling or thinking. They're going to lock me up in a mental institution. And they don't. Unless they feel like you are about to harm yourself or somebody else, they're going to just listen and they're going to help you. They're not going to lock you up in an institution and forget about you. That's not how that works. So, speak with your doctor and tell with your doctor exactly how you're feeling. There should be no judgment. For the longest time, I thought that the things that I was thinking about, I was like, I felt embarrassed about what I was thinking. Like, this is not normal. Why would anybody think this? And that kind of, because you don't want to talk about it, then you feel isolated. So therefore I said, talk with the therapist, talk with your doctor, talk with someone that will listen. And then, just reach out. There's somebody out there that will listen. Like I said, you can call me, text me, reach out to me. I will be there and I will talk with you and help you out in whichever way I can. So, but yeah, I'm going to give more information about, different treatment plans and how it works in a future episode, but because I'm going to just kind of loop them all together. But, so yeah, like I said before, with depression, there are different types of depression, and I'm not going to go into too much detail about all of them, because some of them can be an episode on their own. So I might group them together and make more episodes. But so the first one, which is said to be the most common one, is called clinical depression, or also known as major depressive disorder. And that is just, you have severe sadness and feeling of loneliness, and, it is your most severe version of depression. And if you have major depressive disorder, it's not going to go away. So unless you get help, it's just going to get worse. So if you are feeling depressed and sad and lonely and worthless and all of those things for more than 2 weeks, you need to go see someone. You need to go get help. There's no shame in getting help. And you know what, guys? There's also no shame in taking medication. I think, everybody can do with a little bit of a pick-me-up type medication. Not recreational drugs. I'm talking about like prescribed stuff. Okay. So anyway, the next category or the level of the type of depression is called PDD, or it used to be called PDD dysthymia. I hope I pronounced that right. And that is a persistent depression disorder. And a lot of times this is mild and moderate. And these symptoms can, to be diagnosed with PDD, you need to have depression, a mild to moderate depression, for more than 2 years. So, that means you've been struggling it for a long, long time. Then the next type is DMDD, or disruptive mood dysregulation disorder. And this is a chronic, intense irritability. And there's also a lot of frequent anger outbursts. And this is typically in children, and it will start at the age around 10. So if you're a mom or a dad, or aunt or uncle, and you have a child in your life that has intense irritability or moods or frequent anger outbursts for no reason whatsoever, it might be good to get them to a doctor to just make sure that everything's okay. It might not be this diagnosis. It might be something else. They might have something going on that they just need to talk through. And once they've talked through whatever is bothering them inside, then, these symptoms will go away. But, talking about things is always, in my opinion, one of the best form of treatments is talking about it. And therapy is a great place for that, because you can go and tell your therapist whatever it is that you want, because they are there to advocate for you. I mean, you can tell your therapist that your husband is, being a butthead and he's annoying you and all of that. And you don't have to feel guilty for feeling this way, because your therapist is like your sounding board, and they are on your side. They got your back. And, like I said, therapy is, for me, is one of the best treatments in any mental health disorder or thing that you got going on. All right. The next type of depression is PMDD. And this is something that I've recently been diagnosed with. It's called premenstrual dysphoric disorder. And, I've told my friends, that it's, women, when they have their period, just before they have the period, a couple of days prior, they can be irritable and moody and, craving chocolates and all of those. And those are real regular, PMS symptoms or premenstrual symptoms. And those are normal for women to have. So, guys, be patient with women during that time. Our fuse is a little shorter than normal. So, but when you have PMDD, then, I say that it's PMS on crack, or it's PMS times 100. It takes those irritabilities and it makes it 10 times worse. And typically a day or so after your period starts, those symptoms go away and you feel on top of the world. How it was for me was, I would get so irritated, and especially at my husband. Poor man, like I said before, he's been through so much with me and I love him dearly. But I would get, right before my period start, I would get so irritated with him for no reason whatsoever. Like just him eating or breathing would irritate the living daylights out of me. And I'm like, that is not normal. It is not normal to feel that way towards your husband, unless he upset you for a valid reason. But on a normal day where he's just being him, it shouldn't upset you like that. And, when I've talked to my doctor, they put me on a medication. And so I literally just take this medication about 10 days before my period starts. And last month was the first time that I had the right amount of medication, because I sailed through my period and pre-period, and it was the best time ever. And, I think my husband will attest to that. That is probably the best month of his life too, because I wasn't, I still had the PMS symptoms just a little bit, but they weren't nearly as intense as they used to be. And then the day or so after I start my period, I stop taking the medication and I'm normal. I'm fine. And then, before, like about 10 days before my period starts again, then I'll start taking the medication, and that just helps me get through that. So, and it's a real thing, guys. And obviously it's just ladies who will get PMDD, because, guys typically don't have periods. So, yeah. All right. So the next one is, the next type is depression due to medical conditions. Like I've mentioned before, like if you have a heart disease or Parkinson's or cancer or something like that, it can cause depression symptoms. That doesn't mean you have depression, because once these conditions have been treated, the symptoms of depression will typically go away. So again, that is why your doctor will do all kinds of testing and all kinds of things to make sure that you don't have an underlying issue going on before they, say that, okay, you're suffering from depression. Then the next one, and I think this one is one that affects more people than they would actually admit. And that's called seasonal affective disorder, which is also seasonal depression. And you typically get seasonal depression during fall and winter time, because you're always indoors. It's cold. It's miserable outside, and you're always bundled up, and it's not. Most people. There's some people that love the winter time, and there's most people that don't. And typically, and also you don't have as much sunlight. That's, I think, the biggest part of getting depression during that time of the year is because of the lack of sunshine, the lack of vitamin D. Because think about it, in the summertime, you're always outside doing stuff, and there's the days are longer, the sunlight days are longer. So, that is what probably causes seasonal depression, is the fact of it's a lack of sunshine. My psychiatrist told me the other day that there's like a light therapy that you can use during this time of the year that it basically turns on your bedroom light in a slow way, almost like the sunrise would do. Even though it's still dark outside, you kind of get that. It tricks your brain in thinking that the sun is coming up earlier than it normally would. So there are alternative treatments out there to help with different levels of depression. You just got to do some research on it. It's kind of interesting. And then and another thing with seasonal depression, typically the symptoms ease up or go away in the spring and in the summertime, which makes sense. And I'm sure there's other like seasonal depression, like sometimes during the holidays, some people can get depressed because they don't have family around, or they lonely, or they, I can see people getting depressed during that time. But, once the holidays are over and life goes on, then, their spirits kind of lifts up again, and things start getting better. So I think that, that's why I said, I think there's a lot of people that suffer from seasonal depression that is, let's say, undiagnosed. But, it in some cases it can be severe, and people need medication during those months. And for some people, it's just a sad, or, a sad or blue time in their life, if you will. So the next type is prenatal or postnatal depression. And honestly, I didn't even know that there is such a thing as prenatal depression. I mean, I knew about postnatal depression. So prenatal depression is actually being depressed during your pregnancy. And I think it has a lot to do with the hormones being out of whack, and, brain chemicals being out of whack. And the same with postnatal depression. This typically starts up 4 weeks after a baby was born. Then the mom will have postnatal depression. And it can, in some cases, be so severe that mom can't even take care of her newborn baby, that all she wants to do is just sleep and lay in bed. And so obviously it's not good for a mom to struggle with those symptoms. So yeah, if you're a new mom and you're feeling like nothing is making you happy, and you're feeling sad and depressed, and a lot of times moms, when they have that, they feel guilty, like, I have a newborn baby, why am I feeling this way? And they don't want to talk to somebody because they don't want people to know that that's how they feel. But in some cases, it can, like I said, moms are not able to take care of their babies. So if you are that mom, just know that there's no judgment. Go see your doctor, talk to your doctor, and it's okay. You will be okay. Then the next type is called atypical depression. And it's similar to major depressive disorder, but it has some slight variations from your typical depression. And so what this is, basically, you'll have a temporary mood improvement. So you'll feel better when there's like good things happening in your life. So you'll be depressed, and then when something good happens, then you feel better. You feel like things are great, and life is great. And then, people that do have this disorder, atypical depression, when their symptoms of depression comes back, it can cause an increase in appetite, and those people are typically very sensitive to rejection. And this one in particular, I want to do more research on and see is why all those things happen to people. And like I've mentioned before, with my bipolar, or anybody with bipolar, you have an aspect of depression, and then also on the flip side, you'll have your mania. So you have the bipolar and depression, or you have depression and mania going hand in hand with people with bipolar. So they obviously have depression going on too. So, next question is like, who can get depression? And the research that I've done is basically anyone can get depression. Children, adults alike, anyone can get depression. Typically, women are more inclined to get it than men. If you think about it, women have PMS, and women can be pregnant and all of that. So typically women are more prone to get depression than men are. But it doesn't mean men don't get it. There are men that struggle with depression just as much as women do. And again, to those guys, you are not alone. It is okay. And it's okay to not be okay. And it's okay to ask for help. And it's okay to be on medication. I know there's a stigma out there that being on medication, like, you don't want to be on medication because it's not good for you. Or some people I don't want to go speak to a psychiatrist or a therapist. What do they know? They quacks. At the end of the day, from my experience, all of those things help. And it's helped me through some really, really dark times in my life. And it can help you too. And if you're, being on medication right now doesn't mean you have to be on medication lifelong. Sometimes you just need medication to get through whatever's causing your depression right now. It can be, you can have a bad time in your life. So, medication can just be temporary. It doesn't have to be permanent. And, but again, like I had a doctor once tell me, it was actually when I was going through my divorce, she actually told me, she said, the medication I'm giving you is to just take the edge off. It will make the highs not so high and the lows not so low. And, it will help you, like, during that time, it will help you stop crying. And, so a funny story, during that time, one day I said to my son, he was like 7 years old, and I said to him, hey, can you go get mommy's pill bottle next to your bed? Because it was time for me to take my medicine. And, he was like, Mommy, why do you take this medicine? I said to him, well, because, it helps me to not cry. And he's like, oh, but you're not crying. I was like, well, yeah, because the medicine is working. So, and that is just a little story. Just to be honest about it, kids can understand what you're going through, and they learn from you. So, it is pretty common for people to have, depression. Research have shown that there's an estimate of 7% of adults in the U.S. that are diagnosed with depression every year. And then more than 16% of adults, that is 1 in 6 people. So if you're in a room with 5 other people, one of you have had depression at some point in your life. So, I mean, that's pretty high. And that's also, kind of like treat your neighbor with kindness. You don't know what they're going through. And give everybody a smile out there, because that smile it might just be what that person needs that day. And then there's also, it shows that 4.4% of children in the U.S. is suffering from depression. So, and they also say that, these numbers are probably much lower than reality, because people don't necessarily go to the doctor. They don't necessarily go and talk about what's going on. So I know some of you might probably be asking, like, well, what causes depression? Well, there's several different things that can cause it. One can be brain chemistry, like in my case with bipolar. It's definitely, or it's basically just the chemicals in my brain are out of whack. So the chemicals are not doing what they're supposed to do, and it can cause depression and all of that. It's like as the DMS book says, it's an imbalance of neurotransmitters, including serotonin and dopamine, and contributes to the development of depression. And sometimes, in some cases, genetics is the problem. Like if your parent had depression, it's very likely that you as the child will have depression. My dad had major depressive disorder probably all his life, or since I can't remember. We are thinking that he does, or he did have bipolar 2 as well. So yeah. And then another thing that can cause depression is stressful life events, like going through a divorce, or the loss of a loved one, or you're going through some kind of trauma, or like in some cases it like police officers that see a lot of negative things that can cause depression over time. And there's so many different things that can cause it. And then I've mentioned that the medical conditions, or, can be an underlying reason as to why depression can happen. But then also people with chronic pain can have depression, or people with diabetes, or people with cancer. All of those things can lead to someone having depression. In some cases, medication can also cause depression. I mean, you can listen when they have commercials on TV about medication, and then they will tell you at the end, like, this medication can cause suicidal thoughts, or it can cause depression, or it can cause all these things. So, in some instances, doctors will prescribe a medication for whatever the reason is, and they will want to see you on a regular basis to make sure that it's not triggering, for you to have depression. But then also, if you're taking certain medications and you're told not to drink alcohol while you take it, you probably shouldn't, because, adding alcohol or other stuff to, your regular medication can cause you to develop depression. Something that I read about while doing research for this episode was, preventing depression. And, just like with most things, getting regular exercise, getting enough sleep, all of those things will obviously help. But, there's three things that the research that I found in this instance says that it doesn't necessarily prevent it, but it can help make the severity not so bad. It can just help some. And, maintaining a healthy sleep routine. I've actually heard a saying, or not a saying, I read an article about it where it says that on the weekends, if you normally get up at 6 o'clock in the morning during the week, you should get up at 6 o'clock on the weekends as well, because otherwise, if you're sleeping in until 10, you're disrupting your sleep routine. So getting a healthy sleep routine, also, getting off your phone like an hour before you go to sleep. I don't even know if I could do that. So I know that one's hard, but if you can start doing these things, it can help lessen the symptoms. And then also managing your stress levels, finding healthy coping coping skills to treat or to help with your stress levels. And then doing self-care activities like going to the gym, going to yoga, doing meditation, doing things that help you relax. These things can help with depression symptoms, and it can also help in some cases prevent depression. Like when you're going through a hard time, you've lost a loved one, try and stick with your routine, because that will help you, get back into the rhythm of life. Because if you're just going to go sit and wallow in what's going on, then depression can get hold of you and things can get really bad. So, but yes, like I've mentioned before, you guys, if you feel like you're suffering from some form of depression, please reach out. You can call me, you can contact me, reach out to a friend. I know there's a website called, I think it's Better Health, and they help you with therapy on demand. So you can, do therapy via video call, or you can text with them. They're not sponsoring this episode. I just know that they are good to help with these things. And then, I'm just going to close out with answering the question for today or the question for this week is, if you could have a superpower, what would it be and why? In my instance, I would love to be able to read people's minds. There's a movie called What Woman Wants with Mel Gibson. It's an old movie. I think it came out in 2000, but the movie basically is about Mel Gibson being able to read women's minds. And there was a scene where there was a lady who was depressed, really, and she felt like nobody's seeing her and nobody will even care if she's gone. And he was actually able to help save her life, because she was going to try and commit suicide, and he was able to save her life because he noticed and he could hear her thoughts and all of that. And to that point, I would like to be able to read people's minds, simply because I would like to know what people are going through and how I can help, and have those underlying things, like knowing what they're needing. And then also in my own, it's like a little bit of a selfish reason, but for myself, having, knowing that I might think that people don't like me. Meanwhile, they are just in their own world. So knowing what they're thinking might help me not, project and say, oh, they don't like me. Meanwhile, they actually do, or whatever the case might be. So that's my superpower that I would like to have. But I also probably would like to be able to turn it on and off, because I don't think I want it all the time. Anyway, so guys, I'm leaving you guys with this, and like I always say, this too shall pass. Seize the moment, seize the day, and just know that good times or good moments will pass, but the bad times, the bad moments, they will pass. And reach out and ask for help and keep fighting. And I'm always here if you guys need someone to talk to. And I will talk to you on the next one. Talk to you later. Bye.